Prior to the pandemic, we knew we had an issue, a mental health crisis for LGBTQ people, for a variety of reasons, including the fact that a large portion of us live in poverty. We have two pandemics. We have COVID and we have mental health. And you need to be thinking about both of them. Made a little bit of progress, found with our county partner, Boulder County, a partnership, a brand new partnership. And we're waiting to sign the contract. I think it'll be in place very soon. We have 15 slots a week that'll be funded for people who need mental health services and are unable to access them for whatever reasons.
So in December and January, we ran the first LGBTQ COVID vaccine perception survey. And we thought it would be great if we got 50 people. We ended up getting 272 responses, mostly centered in Boulder County, but in some ways beyond as well, because people really wanted to have their voice be heard in that. And then we found, to our surprise, that there was twice the amount of hesitancy in the LGBTQ community as the non.
What we found is that a large percentage of our population didn't even have the energy to reach out. Now, that is crisis.
And we found in that survey that the rates of depression, anxiety, and suicidality are much, much higher in the LGBTQ plus community. And again, this has been something that Boulder didn't say, oh, that's too bad. Boulder said, oh my gosh, we have a huge issue here. What are we gonna do about it? And then we're having a town hall, an upcoming town hall on mental health issues, starting the POINT program that will provide an entry point for mental health services and case management services. So, I'm proud to work with an organization that, cares about data and then does something with it to impact lives. I mean, literally saving lives right now in the pandemic.
Umbrella Collective is a group psychotherapy practice, and we're primarily queer and trans clinicians working for the local queer and trans community. We accept Medicaid and private pay, sliding scale, and newly Medicare as well. And we really work with specialized training to help people navigate their intersecting identities and help that contribute within the context of their psychological well-being. I feel so passionate about the POINT because Marty came to me at early 2021 after some losses in our community, among our trans community. We had to come up with a response. And so this POINT program, we're seeing a lot of demand for therapy in low supply. So it's a way for people to get access to a therapist right away to talk through and get that holistic evaluation that is, precise and really going to meet the community need, the individual's need within their community.
I am the bilingual bicultural therapist at Umbrella Collective. The point of the POINT is to have a program that people can come and receive therapy when there is no room to help them in other organizations. So they're not just left out there while they're waiting to be seen by somewhere where there might be an opening.
Well, I think it's essential for everyone, so access to mental health. I think we all need it at some point, and we all need it at various points in our life. And specifically for the LGBTQ community, as someone who's part of the community, I have seen just how many discrepancies there are in the system, and particularly there are some really specific things for our community when you're thinking about mental health and what it means to be an LGBTQ person in this world. And I think having accessible and inclusive care for our community is essential for well-being.
Or for me personally, I feel like this kind of work is so important. I have two family members who have taken their life. So 2 years ago, my nephew, Pasha, who was 26, he was gay and was questioning his identity, took his life. And then on March 12th of this year, my ex-husband and very dear friend took his life, and he was transgender. And I think that having resources available to people, especially LGBTQ community, is so critical. It's literally, it can be life or death. And so I really appreciate and value these impulses that Boulder County is taking, these impulses they are taking to expand mental health resources for people who are really struggling and suffering because of society's views and disregard for human life and human dignity.
People walk in our door looking for support, and up until this point, Al Boulder has just said, think about calling X, Y, and Z. And now we can say, how about you come in on Thursday at 2 o'clock? And that feels good. And the point is an entry point. We're small. We're figuring this out as we go. We're going to launch with everything we know that's informed by a community survey. And we hope that we will save some lives. We hope that we'll provide some support to make life better. You don't need documentation to receive these services. You don't need an ID. You don't need money. And that will remove some of the barriers. Am I dreaming big? Yeah. Because if you don't dream big, chances are nothing's ever going to happen. And if we keep doing things the way we're doing things, we're going to get the same thing. And what we currently have is a system that is unable to take care of those among us who have been most marginalized and who have some mental health issues, myself included, that requires therapy.